Everybody. Thank you so much for joining the SCAN Health Plan seminar this afternoon. My name is Mary Malone. I have had the great privilege of working for SCAN Health Plan for 17 years. So I do believe I come to you with a lot of experience, not just with Medicare, what it is, how to sign up for it, all the rules and regulations, but of course with SCAN Health Plan benefits. On this screen and in upcoming slides, you'll also see my contact information, but please do take a moment to jot it down. So Mary Malone, this is my cell phone number, so you can call me, you can text me, or you can email me, whatever is most convenient for you. I also meet with people individually, so if you'd like that, I'm happy to meet with you on a private Zoom, or we can meet in person at a local coffee shop or just over the phone. So I'm very flexible, whatever works for you. I know the world of Medicare can be very confusing, so don't worry about it. I will break it down for you. And I tell everybody, don't worry about remembering all of this. That's my job, and I'll be here for you long after you enroll with SCAN. Alrighty, so let me tell you a little bit about SCAN Health Plan. We started our company back in 1977. It was actually a group of 12 very passionate seniors that wanted more in the way of their Medicare benefits. There just weren't a lot of options back then. And so they called themselves Senior Care Action Network. So today we simply go by SCAN Health Plan. So we are known as a Medicare Advantage plan. We contract with Medicare to bring your benefits, and we bring a lot more. The advantage of a Medicare Advantage plan is that we bring more to the table than what you would get with just original Medicare. SCAN has always been a not-for-profit plan, and I'll tell you why I think that's important. Because the money that we make over the course of the year, it gets reinvested back into member benefits and services. We do not have to answer to shareholders or pay out to shareholders. And when you see our benefits, I think you'll see the difference. Okay, so this is our official star rating sheet from Medicare showing that SCAN has received a 4.5 out of 5-star rating. So that is pretty good, folks. Here's our brag sheet here. So again, you'll see the 4.5 out of 5-star rating from Medicare. US News and World Report has said that SCAN is one of the best plans to join several years in a row. And then down here, you'll see some of our, whoops, let me go back up to that, our awards that our member services team has received. And really, they're the secret sauce. So we can offer these great benefits, but without a strong member services team, it's not as good, right? You know, it's member services so important. So we've got the bragging rights right here. Okay, for folks that would like translation services, we can do that. I can provide a translator to provide you with the benefits. We can also send a translator with you to any of your medical appointments. So just let us know, please. Okay, so here is our agenda for today. So first, we're going to talk about Medicare, how it works. So the nuts and bolts of Medicare. And then we'll follow that by talking about the SCAN benefits in detail. And then from that, I'll talk to you about how you can enroll with SCAN Health Plan. So what is Medicare? So Medicare is our federal health insurance for US citizens and residents. It's administered by the Center for Medicare and Medicaid Services. You may have seen mail arrive to you from either Social Security or CMS, so that's official. And Medicare is available for anybody 65 years of age or older, for those under 65 with certain disabilities, and then for anybody with end-stage renal disease. And then down here in the corner, you'll see this, we call it the red, white, and blue card. This is the official Medicare that you sign up for. So first, before you can join a Medicare Advantage plan, you need to sign up for Medicare Part A and B. And you may want to jot this down. So when you're turning 65, you'll register for Social Security online at SSA for Social Security Administration, so ssa.gov. You log into that, you'll create a My Social Security account. You'll look for that little tab, create that account, and then from there, you'll apply for both Medicare A and B. if you're still working and your benefits are great at work, you don't need to sign up for Medicare at that time. You can choose to just sign up for Part A, and there's no premium for Part A. So go ahead and sign up for that in your, when you're turning 65, and then you can add the Part B later. This is also really important to note. So if you're going to delay getting Medicare Part B, that you need to factor in a 3-month window prior to retiring, prior to your health coverage from work going away. So 3 months before you retire, you'll sign up for Part B. There's special forms that you have to fill out on paper forms and then submit them. So just call me at that time. I'll get you the current forms and guide you through that process. But if you're turning 65 and you can apply online, it's super fast and simple. It takes about 5 days to get the your Medicare information online. Alrighty, let's talk about the different parts of Medicare now. So original Medicare that you're signing up for, the Part A and Part B, right? So Part A is hospitalization. So with original Medicare, before, if you didn't assign it to an insurance company, there is a hospital deductible, and that deductible is $1,556. Pretty steep, right? So that's why a lot of people take that original Medicare and sign up for Medicare Advantage plan. Here at SCAN, our deductible for hospitalization is zero for everything in terms of deductibles. Now, Part B is the other side of Medicare, and that pays for all other medical costs. So your doctors, urgent care, ambulance, blood test, MRIs, those sorts of things. Now with Part B, there's the 80-20 rule that maybe you've heard about. So Medicare will pay 80% of those fees. You would be billed 20% for each and every service that you have. It's another huge reason why people join a Medicare Advantage plan, because we eliminate the deductible at SCAN and we help close that 20% gap. Wait till you see all the zeros with SCAN for our services. Now, Part B does have a premium. It's based on your income. I will tell you, though, that the average person, the vast majority of people, will pay $170.10 for their Medicare Part B. So if you're contemplating, well, do I keep my work insurance, or I just drop that, keep working, but just drop the insurance and hop over to Medicare? So think about what you're paying for to have that company insurance, and then think about what your copays are. And honestly, just give me a call and we'll talk about it. We'll see which way is the best route for you to go. So when you take your Medicare A and B and assign it to a Medicare Advantage plan, that's known as Part C. So the insurance companies are Part C. So SCAN is a Medicare Advantage plan, Part C. And the neat thing about this is that we are going to include the Part D drug coverage. So I think D for drugs. Medicare says that when you turn 65, you have to have some form of prescription drug coverage. And it's fine if you're getting it through your work insurance, you won't be penalized. But otherwise, if you're not, you'll need to get it either by purchasing a separate Part D plan. But if you join SCAN, you do not need to do that, because we are going to include it for you. We make sure that you're penalty free from the time you turn 65. So I know there's a lot of scary advertisements out there about penalties, but when you join SCAN, that we provide that Part D for you. All right, let's move on. I want to point out that there are state and federal programs available to assist people that are lower income. And if you're not certain if you meet that income requirement, just give me a call and I will let you know. But these programs are wonderful. They'll help pay that Part B premium in part or in full. It'll also help lower the prescription drug copays. Now, Medicare comes in many different forms. SCAN Health Plan is a Medicare Advantage HMO. And with an HMO, that just simply means that you see your primary care doctor and they will refer you to the specialist within their medical group. If you're not certain if we have your doctors, call me up. We'll go through those and I'll let you know. We also have a couple of special need plans. We refer to them as an SNP for special needs plan. We have a couple here at SCAN. We have our diabetic balance plan. So if you're diabetic, let me know. The balance plan might be a good option for you. We also have a few plans for people that have both Medicare and Medi-Cal, or some people call it Medicaid. And then we also have a couple of employer group plans as well. Okay, so Part D, the drug coverage, can seem a little complicated. And Medicare does want me to review this with you. So the Part D drug coverage has 4 different stages. Stage 1 is the annual deductible, the amount that you pay up front before coverage starts. And remember, I said at SCAN, we do not have any deductibles, so that includes the medications as well. So that means you just start out by paying your very low copay price for medications. So you're going to start out right here in the initial coverage stage. And this is the dollar amount that Medicare gives you each year to go towards the purchase of medication. In 2022, that dollar amount is $4,430. And so that's the retail price of medication. Every time you pick up medication, SCAN will send you a statement. We'll let you know how much money you have left in this initial coverage limit. The good news, SCAN members, 93% of all SCAN members stay in this initial coverage limit, which is great. And then another great statistic is that 90% of all SCAN members pay a zero copay for all of their medications. So that's really good news. Now, some people that are taking a lot of medications or very, very expensive medications, they may exhaust that coverage limit. And if they do, Medicare will transfer them to stage 3. Stage 3 is called the coverage gap. It's also known or nicknamed the donut hole. So maybe you've heard of that before. So during this stage, because you've exhausted that coverage amount, you would be billed 25% of the cost of the medication. The manufacturer has to pick up the 75% balance. And then if over the course of the year, if what your out-of-pocket expenses are from day 1, January 1st, what your out-of-pocket expenses are, plus the 75% that the manufacturer is contributing during this stage, if it ever adds up to $7,050, Medicare says, stop, these folks need help, and Medicare will then transfer you to stage 4, which is known as the catastrophic stage. At this point, all of your drugs will drop down to 5% or less. So I know it's a lot of information, but just remember that 93% of SCAN members stay right here in their initial coverage, and most are paying a $0 copay for all their medications. When I meet with you, I'll look up your medications. I'll let you know if I think you might go into the donut hole. So I don't want there to be any surprises. Utilize my experience. Okay, so not often, but every once in a while, I'll meet somebody that's taking a medication that's not on our formulary. And if so, I'll let you know. We will give you a 30-day transition fill to give you an opportunity to discuss with your doctor, perhaps a substitute that SCAN offers in the same therapeutic class, or to ask SCAN to have that available for you, specifically sort of getting permission to have that medication. We want to work with you. Okay, so are you eligible to join SCAN? So yes, you're entitled once you have both Medicare Part A and B. You must live in our service area. We're available in all of the 7 core counties in Southern California, also available in some counties up in Northern California, Nevada, and Arizona. So when can you sign up for Medicare? So for those that are just turning 65, you have this 7-month window to sign up for Medicare and then turn around and sign up for a health insurance plan to attach your Medicare to. So it's all surrounding your 65th birthday. So you get 3 months before you turn 65. And remember, you'll apply at ssa.gov. So you got the 3 months before, the month of, and then 3 additional months to sign up. And then every year there's the Medicare annual enrollment period. So this is an opportunity to change your insurance from one company to the next. So that's October 15th through December 7th. Coverage then begins on January 1st. There's also the open enrollment period, which is January 1st through March 31st. During this period, it's a little bit more specific than the annual enrollment period up here, because anybody with Medicare can make a plan change during the annual enrollment period. Down here in the open enrollment, it's a little confusing, right, with the different names, but during this phase, it's only available for people that are on Medicare Advantage plans. So people that only have original Medicare, never ever signed up for anything, or for people that are on supplementals, they would not be allowed to make a plan change. Okay, well, except there are a handful of special enrollment opportunities. Probably the biggest is like when I meet with people, they think, you know, I'm going to save money by joining SCAN. I'm going to keep working. I'm just going to opt out of my work insurance. So then you sign up for Part B. That creates a special enrollment period. Maybe you're moving or have moved recently, leaving your employer group plan. If you're institutionalized, that just means you're living in a skilled nursing facility or a nursing home. Those that are diagnosed with a chronic condition, for example, SCAN has our special needs diabetic plan and our connections plan for people that have both Medicare and Medi-Cal. They can make a plan change throughout the year. Okay, so why consider SCAN Health Plan? We've got our highly rated, award-winning SCAN member services team, our consistent year after year 4.5-star rating from Medicare, and 90% member satisfaction score. So we're really proud of that. And then when you join SCAN, I think one of the biggest pluses is that you get me as your representative, somebody that's familiar with SCAN, understands how to navigate the sometimes complicated medical world. So I will be there for you. Okay, so we've got a couple different plans to choose from at SCAN. Over here, our Connections and Plus plan. These plans are specifically for people that have both Medicare, Medi-Cal. So if you have both, let me know so I can get the proper paperwork over to you, or the benefit highlight sheet for you. Because today we're going to be focusing on our Classic, Prime, and Balance plan. Let me go to this next screen here. So we've got them laid out here in a row. So Classic, Prime, Balance. With the benefit details listed over here on the side. So the Classic plan is by far our most popular plan. The Prime plan has all of the same benefits as the Classic plan, but with a few extras. And it does have a $25 monthly premium. So I really don't recommend the Prime plan often unless somebody needed to get hearing aids in that year, because it has an enhanced hearing aid benefit, and it also offers therapeutic massage. Otherwise, I say go with the Classic plan. And then here's our diabetic balance plan right here. So we're going to focus on the Classic plan. It's easier to see. It's lined up with the benefits over here, and then I'll just point out when there's a difference. So first, we've got primary care doctors and specialists, zero copay. Well, in fact, everything I'm going to be talking about in this whole column, zero copays. So pretty nice. For those that are diabetic, we do provide diabetic supplies and training at no cost. Your annual physical, all of your preventative services, your labs, your x-rays, diagnostic tests, which would include mammograms, colonoscopies, bone density tests, those sorts of tests completely covered. So is outpatient rehabilitation, which includes physical therapy, the PT, OT for occupational, and speech therapy. Even these big, expensive tests, MRI tests can be well over $10,000. CAT scans, ultrasounds, all zero copay. Also, durable medical equipment. This might include, something as simple as crutches or a walker, but also items like wheelchairs, hospital beds, oxygen, sleep apnea machines. Also, outpatient mental health, whether it's individual or group therapy, completely covered. Now, in this next section, we're going to focus on hospitalization and emergency care. So we have inpatient hospital care paid for 100%, unlimited days, zero copay, and absolutely everything in the hospital is covered, including any medications they provide for you. Skilled nursing facilities, zero copay. Outpatient surgery, zero copay. Emergency room. Well, see, I want to just point out emergency and urgent care are both worldwide coverage, which means that no matter where you are, whether you're here at home locally or you're traveling to another county, another state, another country, any country in the world, go to the nearest emergency room. We've got you covered. It does have a $90 copay, but we will waive that if you're admitted into the hospital. And so it becomes zero. Urgent care, zero copay. When you're here locally, you do need to go to the urgent care that's affiliated with your medical group. Just ask your primary care doctor, which urgent cares can I go to? Oftentimes they'll have a list already printed up that you can take with you. And it's a good idea to know where to go just in case you need to go, and maybe it's the evening or weekend when the office is closed. If you're traveling outside of this area, you can then go to any urgent care or see any doctor. You would pay up front, but SCAN will reimburse you right away. Ambulance is a $200 copay. And then down here, this is a big circle. If you had this in print, I'd ask you to circle it. And by the way, I can email you this benefit highlight or mail you a hard copy. Just give me a ring or a text or an email, and I'll get this sent out to you. So just remember, Mary said, focus on the maximum out of pocket, because this is your financial protection. If you're comparing SCAN to other plans, this is the item you want to really focus on. You want to pick a plan with a high star rating like SCAN, and pick a plan with a very, very low maximum out of pocket. And this is absolutely the lowest maximum out of pocket of all the plans in Los Angeles County. So $499. What this means is that if you ever had a copay on the medical side, which I know there's not a lot, you're wondering, scratching your heads like, well, how could I ever get up to $499 outside of the ambulance or emergency care? But this would also include things like chemotherapy or radiation treatment. This is the max you would pay for that in a calendar year. The Prime plan beats it by $100 at $399. Okay, so let's shift gears now and segue over to prescription drug coverage. I know there's a lot of columns here. So again, let's just focus on the classic plan. There's only one little detail that's different on the balance plan. I'll point that out to you in just a moment. So I want you to know, again, $0 deductible. So you just start paying the copay price for your medications starting January 1st. We have different tiers of medication. So the medications are already predetermined, the tier. So when you call me and give me your list of medications, I'll know if it's a tier 1, 2, 3, 4, or 5, and that determines the price that you pay. You can also save a lot of money by joining or getting your medications from a preferred pharmacy versus a standard pharmacy. So the preferred pharmacies, they're really all the major pharmacies except for Walgreens. So Walgreens is classified as a standard pharmacy. You can certainly go there, but you would pay more money for those medications. So if you want to take advantage of the savings, just take your prescription bottles over to the new pharmacy. So any CVS, Rite Aid, Walmart, Costco, Sam's Club, Vons, Ralph's. And then a lot of the small independent pharmacies, many of them are also considered preferred. Some are standards. If you are going to an independent one, just let me know so I can look that up for you. Now, both our tier 1 and tier 2 medications are a zero copay. So that's why when I said 90% of SCAN members pay $0 for their medications, most medications that seniors take are generic because they've been on the market long enough to go through these different tiers. They're tried, they're true, they're effective. And then, of course, we do have brand names available. I'm going to break it down into two categories. So the brand names are either insulin and then every other medication. The reason we do that is that SCAN participates in a federal insulin savings program. And so the price is a little bit lower. So on the classic plan, it's $25 a month. Same with Prime, but look at this on the balance plan, it's a zero copay for all your insulins. And it's protected through the coverage gap. So you'd never have to pay more than zero for your insulins on the balance plan. All other tier 3 medication, brand name medications, so many of the inhalers fall into this category. Those would be $30 for those medications at a preferred pharmacy. And if you ask for a 3 month or even a 100-day supply of the medication, you will get a $20 discount off of the total price for the tier 3 and tier 4 medications. So instead of paying $90, you'll pay $70. So it's nice. It's a little bit of a savings. We contract with Express Scripts mail order. So if you like the convenience of having your medication automatically sent to you every 3 months, just let your doctor's office know that you'd like to have your medication sent over to Express Scripts. And also when you join SCAN, we'll prompt you on, remind you that Express Scripts is available in your welcome packet. Okay, so moving on to dental. SCAN is including your dental, no premium, no deductible. The dental network is Delta. It's specifically the Delta Care USA network. Let me know who your dentist is and I'll look them up to see if they're available. If we do not have that dentist, I'm happy to make a recommendation. Okay, so what's included? So zero copay for your exams and your x-rays and regular cleanings twice a year. And then also deep cleanings, all 4 quadrants, zero copay. And if you've ever paid for a deep cleaning, you know they run between $400 and $500 per quadrant. So this alone adds up to over a $2,000 savings. So it's a very nice benefit. Every other procedure will be discounted by 50 to 60%. There's 290 dental codes that are offered. We didn't want to put them up there. We thought you might fall asleep if we looked at them all. I just want to point out crowns. A lot of people are familiar with crowns. That discount price is $395 versus what you maybe would pay directly to a dentist, maybe $800 to $1,000. So big savings on that. So next up are our included extras. All of these benefits you will self-refer to the companies that we contract with. When you join SCAN, we'll give you all those important phone numbers so you'll know who to call. But I'll name the companies as we go through these. So you will self-refer for all these benefits. So first up, we've got optometry. So for optometry, for your eye exam, zero copay. And then we give you a $250 allowance to go towards eyeglasses. We work with iMed for this, so you can ask your eye optometrist, hey, do you work with iMed? Or you can call iMed directly and they'll send you a list. We also contract with Costco to have your prescription filled. So if you want to take advantage of that savings, you can ask for a written prescription, take it to any Costco. You don't need to be a member to take advantage of the discount on the frames and all of the extra bells and whistles that you can add on to glasses. We also have transportation. You get 32 one-way rides a year, zero copay. On the Prime plan, you get 44 one-way trips. So every time you step into the taxi, Lyft, or Uber, it counts as one way. And then you get 34 on the balance plan. And we also have acupuncture and chiropractic available through the network called American Specialty Health. It's a $15 copay and you get 30 visits each year. It's a little bit different over here on the Prime plan. You get 20 visits, zero copay. And then on the Prime plan only, you get the therapeutic massage at a $5 copay, 20 visits a year. On the balance plan, you get the acupuncture and chiropractic as well. It's unlimited and it's a $5 copay. We also have podiatry, which is a zero copay, 6 visits per year. And this is where you can go to have your toenails professionally trimmed and your calluses filed. Hearing aids are available through True Hearing. You simply call True Hearing up, and then they will make an appointment at a nearby audiology office. So there's 2 packages here. One is $450, the other $750. This one here for $450 retails for $2,500. This one retails for $3,500. So big discount on hearing aids. These are the state-of-the-art hearing aids. They slip inside your ear. You can't really see them. There's just that whisper thin antenna. The one for $70 or $750, you can actually control with your smartphone as well. Now, over on the Prime plan, you have options. You still will use the True Hearing Network, but instead of picking one of those 2 packages, you can get a $3,000 allowance towards a hearing aid of your choice. Or if you pick one of the packaged deals, instead of paying $450 or $750 like you would on the classic plan and balance plan, it would be lowered to $200 or $400. And that's why I said really the Prime plan, the only time I would think it would be necessary to pay the $25 premium would be if you need hearing aids or you want to take advantage of the therapeutic massage. Otherwise, classic plan or balance. Scan travel assurance. So remember I told you earlier that we offer worldwide coverage for emergency and urgent care. We want you to be prepared for your trips. If you call SCAN Member Services or create a SCAN member portal online, it's very easy to do. I'll prompt you to do that and let you know how to do it. But on your member portal, you can ask for this booklet. It's really handy. It even has a passport holder, talks about important things to do before a big trip, who to call if something happens, especially when you're overseas. And it has reimbursement forms in that packet. So if you did have to pay out of pocket, SCAN will reimburse you immediately. Okay, next up, solutions for virtual care. So here we are Zooming. My goodness, how times have changed in the past couple of years. In this category, we have telehealth. We work with a company called MD Live. And through MD Live, you can call and speak to a doctor 24/7, 365 days a year. If that physician believes you need a medication, they'll send it to a nearby pharmacy. I'll tell you, during the height of the pandemic, I used it twice. And I think I made myself sick because I was so nervous. But anyway, I used it twice and it was fabulous. So it's really a virtual urgent care. Next, we've got telehealth. So this is an IT department within SCAN that you can call and speak to an IT expert to help you set up Zoom calls, help you set up your SCAN member portal, any type of technology that supports your healthcare. If they can't help you over the phone, they'll actually make an appointment to come out to your house. The Abridge app. So I'm going to tell you, we've got 3 different subscriptions that SCAN pays for. This is the first. So these like if you were just to get it yourself, you would pay an annual subscription fee. SCAN's got you covered on the Abridge app. This is a smartphone app that was created by a cardiologist for his father. And so when you go into your appointment, ask the doctor for permission to record the exam. and a verbal recording. And at the end, it will give you an abridged notes of that appointment. So it'll give you little bullet points of what was discussed, any upcoming appointments, any new conditions or new medications. And that way you'll have it in your notes and you can actually share that then with people that are helping you make healthcare decisions. Down here, solutions for healthy living. We've got the health club membership. This is through Silver Sneakers. Silver Sneakers, they have a great website. You may want to check it out if you're interested in joining a gym. So it's silversneakers.com. You just put in your zip code or the zip code of where you want to work out. Maybe you're traveling and you want to work out on one of your vacations, or if you're staying with relatives for a while. Because it's a national company. So wherever they are, you can join those gyms and you can sign up for as many different gyms as you'd like. Some of the big ones would be 24-Hour Fitness, LA Fitness, Planet Fitness, and then a lot of the small independent gyms as well. We offer an over-the-counter allowance. It's a $50 allowance every quarter, so $200 a year. You order directly through the SCN catalog. We will mail that to you. Or to make it even more simple, you can order through your SCN member portal. And the catalog offers vitamins, first aid items, even electric toothbrushes, lumbar pillows. So there's quite a few items that you can get from the catalog. We also have the Fitbit watch. This is a great benefit. Our members seem to really like it. I love mine. So it's a smartwatch that has a built-in pedometer, so you can see how many steps you take in a day. It has a heart monitor, a sleep monitor, if you want to turn that on as well. The second subscription that SCN pays for is Brain Fitness. So through this app that SCN pays for, there's different games that you can play, and the more you play, the harder the games get, because you're really working out those brain muscles. So no cost to you for that. So this concludes the benefit portion, but I want to just now take you over to some of the programs that SCN offers as well. So we call it Solutions for Independence. And so in here, we do offer respite care. So if any SCN member was receiving full-time caregiving at home, we can provide a caregiver to help them in the home. And really it's meant to give the caregiver a bit of a break. And so because usually the caregiver that's there full-time, it's usually a spouse or a child or maybe a neighbor, a loved one anyways. So we want to give them a bit of a break by sending in another caregiver that can help with bathing and dressing, light housekeeping, laundry, etc. So that's the respite program, 40 hours per year. Returning to home, this has been so helpful for so many SCN members. When they're returning to home, that's what qualifies you for this benefit. If you call SCN within 7 days of discharge, we will send to you the caregiver, again, 40 hours. And it breaks down into 10 4-hour visits just to get you back on your feet again following maybe a surgery or an accident or an illness. Also in this package, we will provide up to 28 days of meals, and it's breakfast, lunch, and dinner, no cost to you. We also have a program where we can send to you, it's a safety evaluation of your home. And so if you know of anyone that, usually it's for people that are maybe have balance issues and might easily fall, the occupational therapist will come in and do a professional evaluation and make recommendations. Down here, we've got the emergency response system. This is the life alert, just a push of the button, and you'll be connected to somebody that can check in on you. Are you okay? Or did you accidentally push it? And if not, if you aren't okay, they'll send then the ambulance to wherever you are. It's on a tracking device. So, if you fall down, you're not at home, they'll know where to find you. Okay, over here, we've got solutions for togetherness. We wanted to bring like-minded people together by providing several different Zoom classes once you're a member that you can sign up for. Once you become a member, check that out, and you'll be together with other SCAN members taking classes on all sorts of different topics. The third app that SCAN provides, it's called or subscription that SCAN pays rather. It's called Headspace. If you haven't heard of it already, it is a mindfulness and meditation app. Zero cost for SCAN members. So this concludes the SCAN benefit. I'm going to put my, this next brief segment here talks about enrollment. And so here, I just want to remind you that I would love to be your agent, but I can only be your agent and assist you with the enrollment process and long after you're a SCAN member if you have me do your application. It's very simple. If you want to get more in depth on the benefits and you want to meet individually, that's great. Once you're ready to sign up, maybe you want to do this, just call me. I'll do the application for you right over the phone. Please don't just go to SCAN website and sign up online. I don't get to be your agent that way. Call me. If you want to do it online, you have to do it through my direct SCAN website. But really the easiest way is through by calling me. So let me just put my phone number up here again, which is 310-780-2304. And I just want to say a huge thank you for coming out this afternoon to listen to the SCAN benefits and learning a little bit more about Medicare. I wish you all a good day. Take good care. Bye now.